The revision rhinoplasty is a challenging procedure, and not a lot of physicians like to undertake that task.
Yeah, so secondary rhinoplasty or revision rhinoplasty can be a very complicated operation. You are dealing with a nose that's already had surgery. You don't know exactly what shape things are going to be in. You don't know what is there from the natural structure. You don't know what isn't there. You don't know what kind of implants or grafts have been put in. So you're sort of going into uncharted waters, and the nose needs to be explored for starters. That can take a long time because you have to be very careful and very meticulous. You're dissecting through scar tissue, and it just takes a dedication to doing it and doing it carefully and doing it right.
A revision rhinoplasty is needed when a patient already had a septoplasty, where we fix the inside of the nose for breathing, and or a rhinoplasty where the outer appearance was changed. Sometimes the cartilage doesn't settle or scar tissue forms, and a patient ends up unhappy with the result.
In a primary rhinoplasty, we are often borrowing cartilage from inside the nose and the septum. Cartilage that's expendable, that the patient doesn't need for anything, can be borrowed to do a primary rhinoplasty. In secondary rhinoplasty, that cartilage is not available. So we're almost always having to use rib cartilage. Rib is the only cartilage in the body that gives you sort of enough of a supply, and cartilage that has enough strength to it to do a lot of the reconstructive work that needs to be done. Ear cartilage, which is often used, has very limited use. Ear cartilage is thin, it is curved, and it's not an abundant supply. So if you're just doing a small camouflage of a cosmetic deformity, yes, you can use ear cartilage. But if you're trying to rebuild the structure of the nose, ear cartilage doesn't work well. You need rib cartilage. And we're often taking rib from the patient themselves, or we're using cadaveric rib cartilage from a tissue bank. And that's how we're doing most of this revision rhinoplasty. So during those cases, I end up spending sometimes an hour or 2 or 3 on the back table with the rib graft, turning a block of cartilage into all the various structural building blocks of the nose. And then putting them all back in and stitching things back together and reconstructing sort of from the ground up. It is literally like taking a building and knocking it down and building it back up again. These cases can take 6 hours, 7 hours, 8 hours, just depending on how involved it is, and definitely takes someone with a lot of patience and a dedication to this kind of work to get involved with.
In order to get the right rhinoplasty done the first time, it's important to find a physician that can address both your functional and cosmetic concerns. There's no use in getting a cosmetic surgery and then 2 or 3 years later you can't breathe again. It's my belief that the patient should find an ear, nose, and throat facial plastic surgeon who is trained in both the functional and breathing aspects of the surgery as well as the cosmetic. This would avoid a lot of unnecessary revisions afterwards.